Many thanks for your company. When patients in critical condition are transferred to one of the nation's premier health facilities, the Klottey Teaching Hospital, now they expect to get the best medical care possible. But that is often not the case. Indeed, horrible stories have been told of critically ill patients who've been turned away in some instances because there are no beds. The recently appointed Chief Executive, Dr. Felix Anya, concedes Klottey has several challenges but explains there are simple solutions. He told John News' Adelaide Arthur that the lack of beds excuse, for instance, can be easily solved if the various departments are properly coordinated.
As a premier health center serving the southern part of Ghana, the Klottey Teaching Hospital is expected to deliver excellent healthcare services. But over the years, the facility has faced several challenges, preventing it from effectively executing its mandate. One most recent challenge was the breakdown of the hospital's oxygen plant. That problem has, however, been solved.
At the moment, we have 2 of the oxygen plants working, and the other 2 will also come on board very soon. Since June, when those 2 oxygen plants were restored, we've never purchased a single cylinder of oxygen from a private supplier. We are relying on what to be producing here, both in cylinders and through the main pipelines to the various departments and wards. So I can say that yes, we are producing what we need in the hospital at the moment.
The central lab, which was not providing services for some critical cases, such as cancer-related diseases, is now testing tumor markers.
There were no reagents. Those who are having tumor markers like cancers and others, early detection system was not there. We're running okay, but we were not handling the critical part of the patient demand for surgery, for first-line assessment before you give drugs. And nobody can give you a drug when the person doesn't understand how your renal function or your kidneys can handle the drugs and be able to excrete them well. But as I sit now in front of you, I'm presenting another picture to you. Every single test that has to be done, that is marked here, the reagents have come. Equipments have been restored.
This, hospital staff say, forms part of efforts to deliver the best of services to clients.
We are reliably informed that the next place will be pharmacies. The face of a pharmacy will be changed, and then it will be uplifted. And that is also going to create a lot of revenue for the hospital. And when there are availability of consumables for staff to work, it makes things very easier for them, and then more comfortable for the clients that come here and seek medical.
One issue, though, that is yet to be addressed is how critically ill patients are treated when they are brought to the facility. The problem of Klottey turning away patients for lack of beds, Dr. Anya reckons, is an issue of lack of cohesion among departments and not necessarily the lack of beds.
We quickly have to have a hospital management information system which enables us, when the emergency room is full, to be able to keep people at any other empty bed in the hospital and have an emergency team attend to the person there. You know, this is the modern approach to emergency care. At any given time, quote unquote, there will be about 40% of beds not used. And why should people be sent away when we can have people go onto these beds and then they are used? If we have the system there, people who are coming there, when you're coming, send the person to medical, 2nd floor, this bed. So the person goes there, emergency team goes there, whether it's surgical or medical or orthopedic, they take care. And then they handle the person. The person is stabilized. So we don't have people being taken away. That's the present when the people come. It's full. Go. And they don't tell you if you go, where do you go?
Dr. Anya is also advocating the removal of the 34% internally generated fund capping by government to enable hospitals pay debts owed suppliers.
We've had representation on this issue twice to the highest place, and we think that we should quickly get it off the hospitals, because hospitals' IGF are not hospital money. They are revolving fund involving other people's suppliers' money. And the 34% will eat into your capital and the money for other people. So within the context of we owing that much, I think the IGF capping should quickly be seen not to apply to hospitals, not to Korle-Bu alone, to every hospital.
An advocate of health tourism, Dr. Felix Anya, says the hospital has some of the best personnel and equipment to handle some of the most complicated medical conditions. His plans for Korle-Bu are lofty, but will first have to be approved by the board, which is currently not in place. When the board will be constituted remains unknown.
Meanwhile, the CEO of the Korle-Bu Teaching Hospital has expressed concern about what he says is the absence of a recreational center at the hospital for staff relaxation. According to him, the difficult medical cases staff attend to daily makes it necessary for them to enjoy a serene and therapeutic atmosphere at the workplace, where they are able to ease their minds after a stressful day. This, he says, can go a long way to motivate the health professionals to diligently deliver.
As the board comes in, the recommendations that we've all had as a team, the central management team, in terms of staff conditions of service, staff security, staff motivation, staff health, staff, and the whole of Korle-Bu, there's no place for quote-unquote staff relaxation, staff entertainment. If we want to think of, again, medical tourism, we need to humanize Korle-Bu. Korle-Bu is too stiff. You know, there needs to be greens, there need to be flowers, there need to be fountains, there need to be lounges where people can sit and chat and relate. You know, Korle-Bu is, we should humanize Korle-Bu. You should be happy where you are, where you work, and when people come, they feel they are happy they've come to the institution. The place itself should be healing.
Still on healthcare, but away from Accra, authorities of the Komfo-Anokye Teaching Hospital are reeling under pressure over delayed replacement of 150 medical officers for housemanship. The absence of the doctors has forced management to reduce non-emergency medical services, resulting in loss of revenue. Chief Executive Dr. Oheneba Owusu-Danso says medical personnel at post are overstretched. Ohiming Terrier reports.
Only emergency and inpatient services are being prioritized under the current circumstances. Checks at the hospital during a visit on Thursday reveal patients who had reported for elective services such as surgery left disappointed. 4 clinical directories, surgery, medicine, obstetrics and gynecology, as well as trauma and orthopedic are operational. Less than 600 patients had been seen at the time of our visit, compared to about 1,000 on a normal day. Dr. Owusu-Danso says the hospital is already feeling the heat of the situation.
It will affect our healthcare delivery services to the extent that the doctors currently available working will be overstretched. They will be called upon to carry out various functions that previously these colleagues who have exited would have done. And it will also slow down certain processes leading to the ultimate care, because if you are few to go to surgery, for instance, to go and operate, it will mean that sometimes you don't have the adequate numbers of assistants for the lead surgeon, and sometimes when you have to actually follow up to get other resources for the surgery, such as blood, we are going to be constrained. And like I indicated earlier, the scaling down of some elective procedures is also going to mean that we're going to lose some revenue, and some surgeries that may be rescheduled during the period will mean that some patients are going to have some longer waiting time.
For now, patients seeking care other than emergency may have to wait until Finance Ministry gives financial clearance for new house officers. Dr. Owusu-Danso fears dire consequences in the coming weeks, though he assures efforts are being made to avert a crisis.
Especially for people requiring emergency care, we are actually at post, we are actually at duty to provide services. And as we went round, we realized that even our service delivery points for outpatients are all running. But this problem has become more acute this week. Going into next week, we predict that the severity could worsen, and that's the reason why we believe that emergency should continue. But depending on a daily assessment of the situation, elective cases and those cases that do not require emergency intervention may be scaled down.
From Kumasi for Joy News, Ohima Interior reporting.
The Upper West Office of the Food and Drugs Authority has seized and thrown into sewerage unwholesome meat and fish valued at 13,650 Ghana cedis. The products, which were seized at Wizina Cold Store during their routine inspection of cold store facilities in the region, contained 45 cartons of fish and 58 cartons of meat. Upper West Joy News correspondent Rafiq Salam reports from Wa.
The Food and Drugs Authority, FDA, is mandated by law to ensure that any food that is unfit for human consumption is disposed of. They are also to ensure that cold store facilities in the country are inspected and certified. It is based on the aforementioned that the Upper West Office embarked on routine inspection to ensure that the food consumed by the public is of the best quality. However, that cannot be said of Wizena Cold Store, one of many cold stores operating in the region. Officials of the Upper West FDA, on their ritual inspection tour of cold stores in the region, bumped into them selling unwholesome products. It comprised of 45 cartons of salmon fish and 58 chicken thighs, valued at 13,650 Ghana cedis. Gordon Akurugu is the Upper West Regional Officer of the FDA.
As part of our routine inspections, we got to realize that the fish that was stocked in the facility had the cold chain broken, which some had gone bad. Therefore, we had to conduct thorough inspection and then take out all those that were bad found in the cold store. And that is what we have done to safeguard the public. And aside that, it was not like it was at the facility for them to probably not to know, but it was at the facility and consumers were buying, which we think that it is against the law.
That was Rafiq Salam's report from Wa. Now, the Department of Social Welfare says the absence of data on street children is hampering government's efforts to get minors off the streets. Director of the department, Daniel Nona, is therefore calling on NGOs and corporate organizations to assist in data collection. This, he says, will facilitate state intervention to help children living on the streets. He was speaking at the launch of the NGO NUPES Foundation and Family Affairs here in Accra.
We are trying to get NGOs together so that we, as one with the government, will all start getting people off the street. We have developed a tool, and we want to get pick information on whoever is on the streets. And as we are picking them one by one, we are going to look at individual cases. If there are children that should be reunited with their families, we will do so. If the family is because of delinquency, we want to know what to do with them. If it is about the child going back to school, learning vocational skills, those who are destitute and are on the street, we have an infirmary called the Central Destitute Infirmary. So we are looking at individual cases and trying to make sure that we clear the street of all children. And we cannot, as government, also do it alone. That's why we are calling NGOs. We have the Catholic Action on Street Children. We have Street Girls Aid. We have other NGOs that are into clearing the streets, of all those who are vulnerable. So together, we want to even start looking at trying to write proposals together. We know we don't have data in the department, and that has been something that has been worrying me. So when I came in, I've started asking my staff to go and collect data. We want to have baseline data on all the social problems in the country. We need to know how many street children are there in this country. We need to know the number of the aged. We need to know the numbers that are, we have on persons with disability. When we have this and we are working on them, we will know the situation on the ground. Then as we are working, whether we are improving or not.
Now, the Turkish government has donated some 30 buses to the Ministry of Local Government and Rural Development to be used for public transportation. This is in fulfillment of the promise made by Turkish President in March 2016. The Turkish ambassador to Ghana, Nesrin Bayazit, noted that the buses are meant for the development of the district assemblies throughout the country and charged the ministry to ensure they are used for the intended purposes.
Will donate buses for the use of public transport in Ghana. So we've worked on that project, and I'm so pleased that finally it came to an end. And we hope that this will be useful for the people of Ghana. We know that there is great need in public transportation, and this is one part of it. Istanbul Metropolitan Municipality also would like to have further cooperation with Ghana AMA and other district and local government authorities. So we are working on that as well. And these buses came with the spare parts, and it has been quite expensive project. But we are very pleased that Ghanaian people will benefit from this, and we hope we are just seeking, just thank you from them, and it will be. We hope that it will be put in good use, and I have no doubt that the local government and rural development will do everything to see that that will be done.
On her part, Minister of Local Government and Rural Development, Haji Alima Mahama, assured the Turkish government that her outfit will see to it that the buses will be used by the municipal and district assemblies across the country judiciously.
The Turkish government, actually the Istanbul Metropolitan, the mayor of Istanbul Metropolitan, they organized these 30 buses for us. They are refurbished buses. They are not brand new, but you can see, when you go inside, you can see that they are well refurbished. Refurbished buses to support us in our public transport system, urban transport system. And they've also added some spare parts, 40-footer container spare parts. So hopefully they'll be on the road for a while. We'll distribute them to some district assemblies. Definitely not all. 30 cannot go to all, but a few will get some. And we have the Ayoyolo buses in Accra operating. So at least we've learned the techniques, some operational issues from the Ayoyo buses. We would give them to the district. Our plan is to ask the district assemblies that will receive them to collaborate with the GP. I'm not mentioning a particular motor vehicle organization, but we have a number of unions, motor vehicles unions in the country, Porter, GPRTU. So the district assemblies definitely will also hand it over to some arrangement to hand it over to their agencies to run. And our concern is when they pick up the vehicles and run them, whatever proceeds they get from it, it should be used for the maintenance of the vehicle. Of course, they will have to pay the drivers and the conductors who will be running the vehicles, but we would ensure that they open an account, put some of the proceeds in for maintenance of the vehicle. Maintenance is key.
This is News Today. Stay tuned. Thanks for staying on Joy News Today. President Akufo-Addo and his vice, Dr. Mahmoud Bawumia, became the first recipients of the Ghana card. The National Identification Authority, NIA, however, hopes to finish a nationwide digital registration exercise next year, November, before a national ID will be issued. Executive Secretary of the NIA, Professor Kenatefua, says despite inheriting a dilapidated structure coupled with non-existent plan to produce an identification system, his office has worked to turn things around, making it possible to stay within targets set by government to make the national ID a reality.
I am delighted to note that the new Ghana card is a great improvement over the previous one and meets all international standards required of such identity documents. For example, the National Identity Card has been enhanced to take advantage of new technologies, such as tactile elements for the blind, chip embedding technology, and iris capabilities, in addition to taking all 10 fingerprints of an applicant. With a 128 kilobyte capacity, the Ghana card will enable other stakeholders to run their applications on the National Identity Card. Ultimately, the card will replace the sectorial identity cards in circulation and shall be the only card to be used in transactions where identification is required as provided by law. This registration exercise is also unique in the sense that it would involve the registration of ages 0 to 5. This is a historic opportunity for us to sanitize and rationalize birth certification in Ghana and ensure social inclusion right from birth. I wish to congratulate Identity Management Systems Limited, IMS, who are partnering with NIA to ensure the efficient rollout of the NIS project. It is noteworthy that one of the positive results of the NIA-IMS partnership is the funding of a public key infrastructure, PKI, which would be in the custody of the National Information Technology Agency, NITA, to support the development of e-commerce in Ghana. As I've stated on many occasions, my government is fully committed to supporting and enhancing the capacity of Ghanaian companies and businesses to be the giants in their respective areas of operation. Let me remind the stakeholders in this exercise of the need to ensure the integrity, security, and confidentiality.
Let's focus on education now. Named among the Ghana Education Service's top 5 deprived schools in the Greater Accra region, the Mamprobi Soko Primary and Kindergarten School lacks basic infrastructure and amenities. The school, which has for over a decade provided basic education to residents, has been turned into a refuse dump, compelling the authorities to reduce contact hours between teachers and students and instead use the time to clear filth lodged in and outside their classrooms. The school's headmistress, Vicentia Salasi Vanini, says several calls on the municipal authorities to help address the problem have proved futile. Nancy Emefandratosi has more in this report.
After relocating from Lashibi in 1973, Mamprobi Primary and Kindergarten schools have for 14 years provided basic education to residents of Mamprobi. However, the school lacks a library and a computer lab. Chaplaincy Prefect Jifa Avemega could not hold on to her frustrations any longer.
When it rains, students don't have any place to sit, and most of them, we don't have textbooks to learn with. So 3 people, 4 people use one textbook, and actually we don't have ICT lab, so one PC for about 10 people use one PC. That does not help our ICT learning at all.
This gate, which serves as a main entrance to the Mamprobi cluster of schools, have been replaced several times after unknown individuals breaking often to use the school as bedrooms at night. Circuit Supervisor Madame Mercy Kusiapia says the school is tired of buying padlocks.
With the millennium building, you come and find people sleeping on the verandas with their mosquito nets. You see, but sometimes they have to break into the classrooms, defecate. They will sleep there, and then defecate into the classroom in the teachers' drawers, on chairs and other stuff, which gives the children much work to do the following day, especially during the weekend. Monday when they come, they have to spend a lot of time sweeping, cleaning, and then to get the garbage sent to places. You put a padlock, the following day you come and the padlock is spoiled. So we just have to leave it. Otherwise, we'll keep on buying padlocks all the time, and then there is no money to do that.
So not only are these classrooms converted as bedrooms for members of Mamprobi, they have created their own path through the school.
This school has been used as a passage for the community. At a time, about 2 years ago, we tried fixing a block to block one of the gates over there. To our surprise, the money that went into it, after 3 days, it was pulled down by the community.
As if these are not enough, the community have turned the school into a dumping site. Headmistress of the school, Vincentia Selassie Banini, says they have received assurances from authorities, but nothing has been done.
It is on paper. Even the former mayor, in his speech, said that this block will be pulled down to give rise to another millennium block. And I know the current mayor too is aware of it.
Pupils here are usually in torn school uniforms or simply in house dresses, as their parents are unable to afford them. This then prompted the Children's Safeguarding Affairs Foundation, CSAF, a childcare organization, to provide school uniforms and bags to Kindergarten 1 pupils. Yvonne Nefi is the founder of CSAF.
So when I came last year, I suggested to Ghana Education Services, Mr. Sante, to inform me of the 5 most deprived schools in Accra, and I chose Mamprobi Soko School as one of the 5, out of the 5, because when I came here, something spiritually and emotionally touched my heart, that the kids were walking barefooted. Some of the parents, you could tell, were actually struggling to feed the children, let alone buy school uniforms for them. So it just touched my heart that this is the school, and there was some connection. I don't know what it is, but emotionally I was drawn to this school.
Madame Selassie Banini is calling for support from corporate societies and government.
I'm calling on other corporate society organizations to come in. We have a lot of, we are a cluster of schools, the other, KG there. So if they come in, I think it will help alleviate this illiteracy in the community.
Reporting for Joy News, MFA Nancy Dradosi. The National Association of Graduate Teachers, NAGRAT, says the Ghana Education Service Council did not follow due process in sanctioning the 11 senior high school heads, the headmasters for Pentecost Senior High School in Koforidua and that of the Dufour Senior High School were sacked, while 8 of their counterparts have been demoted. Speaking on News Desk, Vice President of NAGRAT, Angel Kabanu, says the school heads charged monies because government subvention under the free SHS was yet to reach the schools.
Was an administrative way of doing things before this new free SHS policy came in. So I do not see why ultimate punishment be meted out people who have been seen to have fallen foul of those. We will get to the Ghana Education Service and appraise ourselves the details of it and see how we're going to react to it.
What possible reaction should we expect from NAGRAT?
The union was not even part of proceedings, so we don't even know the details of proceedings and what led to the arrival of the decision that was taken.
If you find that the 4 disciplinary procedures were not followed as you are suspecting now, would you consider calling for the reinstatement of these heads?
Yes, it will influence the thing that we are going to take, definitely. When we have a situation like this, there is a school and there are no tables and fares, and government is not made any specific allocation to this, and no indication is there that indicates that the government is even going to send those furnitures to the school in the next 1 month. What should a responsible headmaster do? Should a responsible headmaster be the one who holds his arms in his lap and waits for government to send them? Or a responsible headmaster is the one who will tell the parents, say that, look, your children have come to school, Classes will have to begin immediately. Therefore, we will need 5 tables and chairs to help your own children. Which of these two is more responsible to the situation? So, if you ask me to advise the heads of the schools and the management of schools, I will say, look, you can fold your arms until money comes for specific things. Fold your arms, make the approach to your superiors, and wait for the monies to come.
Still in the education sector, President of the University Teachers Association of Ghana, UTAG, in the University of Education, Winneba UEW, Dr. Samuel Ofori-Bekoe, says the lecturers in the university and across the country will remain on strike till their concerns are resolved. Speaking on News Desk on Joy News earlier, Dr. Bekoe described as an untrue statement made by the chairman of the University Council that all certificates and appointments have been ratified by the council since it was appointed. He says the point was not conclusive as there was no decision made at a meeting. Dr. Ofori-Bekoe says the association will therefore remain on strike until their issues are resolved.
I am a member of the council, and that thing was not conclusive. And so it was absolutely wrong, and it was a defeat of the public for the council chairman to have come to make that announcement. In any case, even at council, when it was inconclusive and said it was going to announce, I made certain statements. And the very police who is acting now begged me not to do what I said I was going to do because he wasn't going to make that announcement. And yet he went ahead and I made that announcement. And so that statement is a palpable falsehood.
The statement made by your council chairman
were not conclusive.
So what is the status of those approvals now?
There is no asset approval. And in any case, if, for instance, they say they are going to approve all appointments, why did they leave out the vice chancellor and the finance officer? Because if you claim that council was an illegal council, you are going to ratify their decisions. Why do you ratify some of the decisions and leave out others when you have no shred of evidence to prove that those other decisions were falsely made?
Now, Doctor, we just heard students appealing to you that in spite of the issues that you have, they are paid to study, and so they would like you to come and teach. What would you tell these students?
I would say that they should send the petition to university management. In this situation, both of us are from promisee. The university is the promisor. They are fighting for certain things to be right for us, to be righted for us. They should also fight for their rights also to be given them.
Away from the education sector, this week, the chairman of Parliament's Legal and Constitutional Affairs Committee made an honest admission that also confirmed the worst fears of critics of the current proposed architecture of the Office of Special Prosecutor. He declared the proposed office can never be fully independent. So today, as we join the world to mark International Day of Democracy, we ask, is the Office of the Special Prosecutor a democratic necessity or a needless duplicate of existing anti-corruption structures? We shall connect Ghana and beyond to add our voices to the ongoing public consultation to craft a law intended to serve our best democratic interest. Join us on Ghana Connect today live on Joy News on TV, radio and online at 5:30 p.m. This program is brought to you in association with Star Ghana. You're watching Joy News today.